Hi everyone, and welcome to VentureJect and today's webinar on hacking humanity with Lara Lewington. Thank you all who are watching and joining our webinar so much for being here and for watching. We're always curious to hear where you are listening in from, so please put in the comment section below or on the side, whatever platform you're on, what city, what country. We're always curious to hear and to learn how far we reach out into the world with our messages, and especially today, our message with Lara Lewington coming to us from the United Kingdom, and we will be taking a deep dive into her new book, Hacking Humanity. So, Lara, thank you very much for joining us. There might be a few people out there in the world who does not know you. Would you be so kind to introduce yourself?
I've been covering technology for the best part of 2 decades, largely for the BBC, presenting the BBC's technology show Click. I have travelled the world and covered some of the greatest innovation, but the thing that I'm particularly passionate about is what's going on in healthcare, the transformation that's coming as a result of AI and tech.
Fantastic. Thank you very much for joining us. And just a quick plug of Lara's book. We put in a QR code here today.
Loving the QR code.
Yeah.
Thank you. Loving the QR code.
Absolutely. It's a technology tool. We got to use all of the technology tools that are available to us. So you've seen a lot, both with BBC Click and technology, and now you have taken a much deeper interest in healthcare and with a popular word, longevity, and how the tech world is moving into this realm. Why do you think now is such an important moment to write a book like this?
I think we are at the point of a transformation beginning. And whilst it's not going to happen overnight, this is a journey to a far better place. The ability to be able to pull in data on our lifestyle, largely through our wearables, also air quality, other factors around us, with other data on our genetics, the incidence of disease, to really understand risk, to know what we're looking for, to screen better, to better be able to predict disease. And that means we can better prevent. These tools are starting to get better. We're now starting to collect more data in more uniform ways, so more useful data, because the data needs to be good enough to make this possible. And I think also there's a lot of interest right now in this idea of embracing preventative healthcare. It can save enormous amounts of money as well as be a far kinder way. And whilst we can't switch the way that healthcare works overnight, a lot of experts talk about the idea of shifting from sick care to healthcare. And I really think we're at a turning point now where we're starting to seriously get on that journey.
Yeah, and I think sick care to healthcare is really a good catchphrase, and we can also see when the way you also put it is there are two sides to this, right? Let's stick with healthcare for today. That there is the societal side and treatment and how we can do it on a grander scale, and then there is the individual. What does it mean to the individual when to them to be healthy, and that's not about healthcare costs, right? That's about quality of life.
Absolutely. And right now, the data in England shows that women are spending 25% of their lives in poor health. For men, that's 20%. That's terrible. That's in a high income country with a National Health Service. So we very clearly have a problem. Now, the solutions are starting to emerge as to what we can do for this. And I also think they're starting to be democratized, which I'll go on to in a moment, because the question always comes, how is this available for everyone? But we know that diet, exercise, sleep are really important. But how do we move from knowing that they're important and a load of contradictory studies often, and knowing that some exercise is better than none, but what exactly should we do? How do we move from that idea to something that's really personalized and really useful? Well, we're finally in a place where we've got the technology to not just track what we're doing, but really simply track the impact that it's having on our bodies and our response. I mean, with what you do at VentureJect, that is absolutely an example of that, a simple VO2 max test. But even the wearables that we're all wearing, what I think is a lot more important than how many steps we did yesterday are those patterns, those long-term patterns, where when changes come, we can start to look at our data and think, well, why have things got amiss? What's going on? Because in many cases, people have started to see the onset of serious illness or something that needs further investigation that they may not have recognized through simply how they're feeling. So that power is really there. And in terms of access to all of this, well, there's a huge variety in cost of these devices anyway. And in the UK, they're starting to become available through the National Health as part of the 10-year plan for people who have chronic illness, for prevention, and people who are leaving hospital after acute treatment. And I think this is something we'll see internationally through insurance policies as well, greater access to these devices that don't need to be expensive, but provide enormous power in the patterns that they can see.
Mm-hmm. Yeah, and I also there is a lot of data collection happening with our watches. I'm not wearing one today. Different.
I'm wearing two. I've got one for both of us.
Thank you, Lara. You saved me there. I only have our device, right? So, but with all this data and all this tracking, there always emerges this question about how can we. What should we think and how should we care about our data and the security of all this, the platforms knowing all this about us? I know you also have looked deeply into this.
Yes, and I think there's a few things here. Firstly, what are we gleaning here at population level, and even in terms of the feedback we're getting from our wearables is all based on anonymized data. So it's not actually the issue that some people may immediately feel it is, that they're handing over this health data. And research has certainly shown that people are far happier to give it to give their data away to healthcare systems than they are to big tech companies. And that's partly because people are sensitive about who is gaining anything from that data. They don't want to see that money is being made from their health. But we also need to really understand what we're handing over, to what end, and what the benefit is, because our healthcare data can be the thing that we are the most sensitive about, yet actually we can gain the greatest benefit. And there have been cases like in places where abortion is illegal, people haven't wanted to do period tracking. And of course there are questions that are raised over these sorts of issues. But I think if we're looking at it at a bigger picture level, and for you, me, most of the people who might be listening to this, well, we can probably gain quite a lot from the long-term data from our wearables. I personally think that it's quite powerful, unless you are somebody who is going to become incredibly anxious as a result of that data. And there's a lot of people who feel that way, and it's not necessarily for them, but at population level, we're learning a lot that can benefit everyone.
Yeah, and I think you make a good point there that there's a big difference between the individual and the aggregation of data. Because those are just very, very different. And of course, it's a personal choice if we want to make our data available to big platforms out there. But still, as to your point, the aggregation of data, it's very often anonymized, and people should absolutely they can feel relatively assured that these platforms are handling it in a good way. And that's also that then brings on to the next question, right? Like from across all of this research and all of this data that is now available, and how should we act on this? Like what have you found while working with this book that are, shall we call it, universal findings on what can promote health?
Yeah, I think it's a really important question about how our human behavior changes as a result. Because just because we know something's good for us doesn't necessarily mean that we act on it. Just because we learn we have bad sleep doesn't mean we go to bed earlier. And I met some great people in California who are setting their alarm clocks to go to bed at night to make sure that they've scheduled in enough sleep, which is great if you're not an insomniac, if you don't have a small child, if you don't work shifts. So I think we need to figure out what works for us as individuals. And through wearing a continuous glucose monitor, I discovered that my biggest sugar peaks were coming from pure vegetable juice. So not smoothies, but pure juice on an empty stomach. And that was having more of an impact than eating dessert occasionally, especially if I was walking home after being out for dinner. And when you find these little nuggets of information about your behavior and the changes you can make, I think many of us can have small takeaways from it. And the idea that, and my book isn't a self-help book, it's a science book, which is the book that probably everyone should read alongside the self-help book they want to read, because it really expresses what's possible for you, but also where human behavior comes into this, and how actually it's about finding out what is possible physiologically, what is possible within your life, and what's actually going to make a difference. Because for some people doing a lot of exercise, they may feel quite diminishing returns on some of this. But actually, if you're going from no exercise at all, a really sedentary life, to a tiny bit, those gains are enormous. So the gains are different for different people. I think that personalisation factor is really important. And also, whilst these devices can motivate, and I think it's good for that for many people, especially if they're of a good competitive nature, even if they're competing against themselves from day to day, actually long-term patterns are the thing that's crucial. There's some early research saying that dementia can be seen 20 to 30 years in sleep patterns before symptoms would emerge. So we are really heading towards some very, very interesting findings. And I actually think the greatest takeaways and the things we should be aware of are the sort of bigger picture science elements of where we're going and the value of patterns.
And that's also one of the things I really enjoy about your book is about this merging of both science, but also something as personal as human behavior, like each of our own individual behavior. Because when you overlay that to this almost famous view of a lifespan and health span, and see how health span is relatively high throughout the first half of your life, and then it starts to decline, right? And that's where really some of these tools that you mentioned, that you cover in your book, how do you also see, or how do you see that these tools can then sustain some sort of long-term motivation, or helping people to peer into the future? What will my physique, my health look like in old age?
Yeah, well, I think there are quite a few things that you can do right now, but we are at the beginning of a lot of it, like biological aging tests. To be able to assess, you could work out your fitness age. Well, you could do that through VO2 max, of course. But you could do fitness age, you can do your inflammatory age, your disease risk age. And the fact is, they may all come back with different numbers. It doesn't necessarily mean they're wrong. It just means they're measuring different things. And this is quite useful information if you're doing it with reliable tests that actually hold steady results, that aren't going to jump in between yesterday and today, because you need to know that they're actually going to be useful information for that period of your life and how you've been living. Then you break down the information from this, and you can actually start to see the elements of your life that you might be able to improve, and those areas where you're already doing pretty well. So keep up the good work, which can, of course, be motivating in itself. And as we learn more, as science starts to understand more about the human genome, for example, we start to get more actionable data. And where we're at the beginning of a lot of these postal kit tests that we can do, a lot of the things that technology is making possible for us to be able to do for ourselves in ways we never could before, and AI is in the background of so much of this, being able to crunch so much data, we are actually learning so much about our own bodies and personalisation, how drugs are going to work on us in the future, how much of them we need to take, what side effects we're going to get. We'll better be able to prescribe with fewer side effects. And when we look at a future of trying to close this gap on health span and lifespan, which is what I always come back to, it's not just about that avoiding spending decades in decline with dementia, with cancer, with the conditions that we may be battling, but also how we're impacted by the medical treatment that we're given along the way. And that can become a lot better. So we are heading to a better place in healthcare. We are also heading to a place where we can understand our own bodies better and do what we can for them. And not everybody is going to be hugely motivated to do the things they should, because as humans, we know what's good for us and we don't always do it. But it can help push us in the right direction. And as I said, with just those small elements, and even if you make a couple of changes in your life, but you actually understand the bigger picture of what's possible, well, that can be really good.
Indeed, the aggregation of small efforts will grow over time, over years. So starting in your 30s or in your 40s, well, that will most likely pay dividends in your 60s and 70s. where an age we all hopefully reach, and then without those 25% of the life spent in illness, as you referred to before, that British women were experiencing, right?
Yeah, well, that's it. We'd like to be able to feel 40 and 80. And there's, of course, a whole sort of side of the longevity space where people want to live for a very, very long time. And that's not the bit that I am interested in, albeit I touched on it. I went to film with Brian Johnson, and that was great fun. And each individual thing he does is rooted in science. And it's really interesting. But I think for most people, we want to avoid disease for as long as possible, feel as healthy as possible for as long as possible. And there's this sort of divide between enjoying life day in, day out, but also feeling good day in, day out. And I don't think we can underestimate the power of, I've just had a 5K run before I spoke to you, and I'm feeling a lot better than I was an hour ago. And just the power of what these things can do for us is great. But we also should be cognizant of the fact that actually there's some long-term benefit to be had here as well. And we're not always good at thinking of the long term.
No, I think that's one of the biases, one of the conditions of the human, of being human. That do I want to feel good now or do I want to feel good later? I take the cake now, right?
Yeah, and I actually think you can get both. And after I interviewed Brian Johnson, I left his house. And I felt really quite psyched. I was actually this was the first interview that he did. And so it was at the very beginning of it. You know, obviously he's now pretty well known. And I left his house having eaten his delicious pudding berries thing that he'd made for me, and seen his workout regime and seen the clinic and seen it all. And one of my big takeaways was he had these amazing sparkly whites of his eyes. He looked like he felt great. So I left and was saying to my colleague, oh, I sort of want to be a bit like him. I don't want to dedicate my whole life to it like this, but I want to take away a little bit of that, which I think is the kind of sensible, healthy living level, not the extreme doing all of this stuff level. And her response was, oh no, I think it looks utterly joyless. But my argument, you see, was that I thought he looked like he felt great. And while she was thinking, but it looks miserable to do this day in, day out, I was thinking, well, he feels really good from it. And I actually like the idea of feeling great. And whilst I don't want to do things to Brian's extremes, I think doing it to the level that you feel comfortable is comfortable and enjoyable, you can really actually gain benefits day to day as well as long term.
I think that's Brian Johnson's example, right? He goes in 100%, right? Like, and it's overpowering what would be considered a normal life with a job and 2 kids, you know, where
yeah, of course,
most likely not
wouldn't
realistic.
do it and wouldn't want to do it, and that's what makes it so interesting. The fact that somebody out there is, and actually, I interviewed 103-year-old Mildred who lived in one of the blue zones, Loma Linda in California. And so she's living in a place where people are living longer than average life expectancy and health expectancy. And actually, the thing with Mildred was she felt like she'd had enough. Her daughter had died 30 years before. Her son was bedbound. She has actually sadly died since, because I filmed this 2 years ago and she featured in my book. And I made a program that she featured in. And I've actually featured her alongside Brian. And I told her about what Brian was up to. And because she lived in this blue zone, and in Loma Linda, they're Seventh-day Adventists, and they're looking after their bodies is almost a duty of religiosity. They feel they have to eat well, sleep well, exercise, because it is a sign of gratitude for the healthy body they've been given, and they should keep it that way. And this was a really lovely approach because clearly it's working. I was interviewing 99-year-old Esther and I had to wait for her to get back from the gym one day. And so what they're doing is obviously working for them, eating a really pure, healthy diet. And that's lovely. And with Mildred, she'd reached this age of 103 and she didn't have any disease and she was of sound mind, but she'd simply had enough. And she was saying to me, I wouldn't recommend living to this age to anyone. And she was nervous every time she stood up that she might fall over. I think she didn't feel a sense of purpose. And when she was younger, she set up hospitals in Africa. She led a very meaningful, fulfilling life as a doctor. And I think she felt that purpose and some of that real sense of why you exist had gone. And I tried to explain to her the concept of Brian Johnson and his don't die, I wanted to keep on living. And she wasn't happy about it. And she said to me, I think this is very selfish unless he's the only person that could possibly do this. And I said, well, actually, I think maybe he is. Maybe he is doing an experiment for mankind that others wouldn't want to do. But look, I think it's very interesting what's going on there in what we can learn from the blue zones. Incidentally, some of them are, their blue zone status, I think, is started slipping away. Okinawa in Japan has lower life expectancy than other parts. The globalization of ultra-processed food is obviously a big part of that. So what we can learn from blue zones in their classic sense and what they're still managing to maintain is quite interesting. It's also interesting to see Brian Johnson's experiments. But I think for many of us, there's a different reality there. Although hopefully there are elements that many of us can take away to try and increase our health span versus lifespan.
And I think Mildred and Brian Johnson also depicts pretty perfectly this old quote. I think it's from ancient Greek philosophy, right? It's with life as with a book. It's not how long it is, but how good it is that matters, right?
Yeah.
So and that's really what I find about your book is you've really taken the time to dive into a lot of science and to discover some of the tools that are enabling us to maybe not live the longest, but have the time we have, live it the best way with the least amount of illness or sickness. So if you were to handpick a few promising technologies that you found during your work with this book, what would you point to?
Okay, what would I point to? Well, certainly the bigger picture of trackers. I mean, nothing specific, just the idea of tracking. Of course, VO2 max testing without having to go through the hideous exercise test is something which is great, particularly for people who, for whatever health reasons, actually can't do the exercise test. So giving people access to be able to use technologies that make things easier is amazing. But what I also looked at in the book was quite a lot of the stuff surrounding visualization ahead of surgery. There was a family, and I followed their journey. They had to make a decision as to whether their 6-month-old baby was going to have surgery, which involved his head being cut open and a spring inserted under his skull. Now, he had a condition that was causing his head to grow in the wrong direction. It could have caused some physical, it wasn't life-threatening, but could have caused some physical and psychological problems throughout his life. But obviously surgery like that doesn't come without risks. So this family had to make a difficult decision. And this was actually going back several years now before we were talking about AI so broadly. But the neurosurgeon who had actually done some amazing surgery separating conjoined twins, he'd become quite well known through that. He had used data from other children with the same condition to be able to create visualizations they could watch in virtual reality as to how his head would grow with or without the surgery. So I was with the parents throughout their appointments, throughout this decision-making process, where they watched in virtual reality and they could move all around, not just a baby's head and how it would change as they grew, but Archie's, their sons, to really see the difference that it could make. And this sort of visualization, the power that 3D visualization combined with AI can give you to understand what's happening in surgery. And I saw this again a couple of weeks ago where I filmed with a lady who was having brain surgery. She had 3 aneurysms and they were found in a routine scan. She had no symptoms, but was advised quite seriously she would probably want to take the decision to have surgery. So this is obviously a very big deal. And to help her understand exactly what was going on, they used a Magic Leap headset, and the company XR Labs had created this platform where you could see in incredible detail exactly what's going in the brain, that you could make the brain half the size of a room. You could make it as big as you want, move around. And in her appointment, I was there with her and the surgeon, and they were showing her exactly what there was going on and what they were going to do. But what they could also do, it meant the surgeon and the surgical team could rehearse the day before on a virtual brain, not just any virtual brain, but hers, because our brains are all so different. So I think there's quite a lot of technologies out there, lab-grown organs, things that are really sort of wild and out there, which are really interesting and are absolutely going to be transformative in their own ways in the future. But when I've seen actual people see the difference that these things can bring, it's pretty incredible.
It's amazing, especially with the power of AI, seeing how everybody becomes augmented. Of course, it's powerful to see when our doctors become augmented with the extensive knowledge they already have about the human condition, about disease, illness, anatomy. and see what augmentation can bring to them. And then, of course, the lower tier is perhaps when we ourselves as private people gets augmented by all the data that we achieve, and our devices tell us you should really stand up now because you've been seated too long.
Yeah, which I know could also be very annoying.
I've been told so by my friends who have these. I still wear an analog watch.
Yeah.
I might
you
not
can
look
turn off
100
these
years
functions.
old, but apparently I am. No, but coming back to a topic that I know many of our viewers are also looking back to, and that we also touched upon a little bit earlier in the webinar here, is about prevention. And preventive healthcare, because it's seeing so much coverage these years, and with the demographics of populations becoming older and older, there's both and societal incentive to do something about this, more prevention, and also an individual desire to do it in order to avoid any more illness than might already be predetermined in our genes. But there is this saying that if you can't measure it, you can't improve it. And then now we also all of a sudden seem to be able to measure everything with these devices. How do you see that all these technologies can be an enabler for more prevention?
Well, I think we are going to start to be able to increasingly frictionlessly measure more. And for example, through something I saw at Consumer Electronics Show this year, was the idea of a device down a toilet to turn it into a smart toilet that it's measuring every morning when you go to the loo. And some of these things which are taking measurements, an electric toothbrush that's able to do more in testing your saliva than they do now. In the future, we're heading towards lots more things that are going to be built into our daily patterns. A mirror that tells your blood pressure each time you look at it. The technologies are emerging, and pulling together these technologies where they are good enough to be able to seamlessly do things in the background. So you're not constantly looking at the readings, but you're getting alerts when something's amiss. And I think this comes back again to this idea of changes in patterns. And those patterns are so important. And when something changes, it can be meaningless, but it can also be very importantly meaningful. And I've just written a feature for a magazine, actually, on someone who had serious heart condition diagnosed as a result of knowing something was wrong with wearables. Somebody diagnosed with stage 4 cancer after saying their readings were amiss. Somebody who was tracking their lupus and saw something at an early sign that they needed to identify through what the readings were seeing. And so we are increasingly going to start to be able to see something's gone wrong there in the pattern. We're also going to have apps that aren't so frictionless, but that we can check in with regularly for things that we know we are at high risk of. If we have cardiovascular disease, those check-ins that we might want to be doing regularly. So as time passes, I think there are going to be more and more ways that we ourselves can keep track of things. And I think doctors will continue to encourage us to. When I first started covering wearables about 16 years ago, I remember this idea of, oh, you could record all this data and take it to your doctor. And at the time, I was thinking, what doctor has got time to look at your wearables data for you to arrive and say, I did 12,000 steps yesterday? It sounds absurd. Well, yes, it did sound absurd then, but actually as time's gone on and they've measured more, they've also become much, much better. That data's become more relevant and meaningful, and there are things that can be done with the findings from our wearables, and doctors are accepting that this data, things like being able to take your own blood pressure at home every day instead of once every 2-3 weeks an appointment. We are really recognising the power in all of that as part of healthcare as well. And doctors want that information because it provides you with constant tracking that you can't get from a doctor. And not all of these devices are medical grade. They have various different levels of accuracy. Some have medical grade parts, but they are playing a really important part there in how you can collect more meaningful data that really gives a true picture of your health.
That's amazing, Lara. Thank you very much for joining us today in our webinar here, for sharing all of the insights that you have gathered, collected, anecdotes from the people you've met and spoken with, such as Mildred and Brian Johnson, both before and during your research for the book, which you, by the way, can find by taking a picture of this QR code.
It's there for
Lara,
me. I don't know if it's there for them.
no,
Brilliant.
it's here. So
It's definitely above
for
you.
everyone to
I'm
see.
pointing at you on my screen. I don't know if I'm pointing at you. It might all be the wrong way round. Anyway, thank you to anybody who's listened to this, and thank you for having me. It's been a nice chat.
Thank you. Take care. Bye,
Bye.
Lara.